And now, let's get on. I'm very excited about our next couple of presentations because we set the table by telling you what is KCNQ2 and really drilling down into that science a little bit. Now we're going to talk about what's happening next and how you can participate again in terms of sharing your information so that as future events happen and we get more things that are potential for your kids, you're going to know about it, and we need the data to help. Which brings me to our next guest from Invitae with an update on Invitae and Ciitizen. Can I please welcome Daniel Anderson? Thank you so much, Daniel.
Good morning, everybody. It's a pleasure to be with you all. My name is Daniel Anderson, and I lead partnerships at Invitae. And I'm here to talk about the race that we're all on. The race to collect the information and get it to the researchers and to the biopharma companies to be able to bring those new, better therapies to market. You know, this morning I've heard a lot about how the options that we have are getting better. We're knowing more and more, but there's still a lot that's needed to get us to the place where we have great options. So during our time together, I'll talk about a couple things, just a little background on who Invitae is, our Ciitizen platform, which allows us to collect medical records on behalf of patients and their families. And then if we have your guidance, we can then share them with researchers to help drive forward our understanding of KCNQ2 and help them bring those new therapies to market. And we'll talk about actually Ciitizen itself, so how you can sign up, but we'll also share back some of the data we've already collected on the 44 patients who are already within our platform. So Invitae, we are a medical genetics company, and our mission is to bring comprehensive genetic information into mainstream medicine with the objective of improving healthcare. And we aim to do that for billions of people. So essentially anybody in a modern healthcare system, we believe that we can help get them access to that genetic information, which can help give that diagnosis. But also after they have that diagnosis, we want to help collect that information and give them the tools to help guide their healthcare moving forward. So Invitae was founded back in 2010 at a time when genetic testing costs tens of thousands of dollars, even for a single gene, and it took months to return results. And our mission was drive down the cost of it to make sure that anybody who could benefit from it could access it. Since then, we've now delivered genetic tests for over 3.3 million patients around the globe. Over 1 million of those were in 2021 alone. So we've made good progress there, but we've also understood that genetic testing and a genetic diagnosis is not sufficient, right? It's not where the patient journey ends. In many ways, that's where the next chapter starts. And so in 2021, we made a big step forward. We acquired a company named Ciitizen, who gathered that phenotypic medical record data from across the whole patient journey. And our belief was, if we're able to take the genetic capabilities in Invitae, put it together with Ciitizen capabilities, we'd be able to not only help inform those patients' and families' journeys, but we'd also be able to help drive forward research and help those researchers get this really deep genetic phenotypic data they would need in order to make breakthroughs. And so my role here is to find the right organizations and companies who share that objective and have common goals. And so, you know, we have many of those folks in the room today. I mean, the Alliance first and foremost, but also with Xenon and Biohaven as well. I will mention that, you know, a couple of our core tenets when we work with partners, number one is patients own and control their data. We look to them to tell us how they want it used and if they want it shared at all. Second, we believe that this information can be more valuable when shared. So again, we look to patients to tell us when they want it shared, but when they say they do, we can then share that de-identified information with researchers to help push forward our understanding of disease. Okay, so our objective is to build a patient-centric network where we'll be able to collect information on patients' behalf. So this will include everything from genetic information to medical records to imaging, things like EEGs. and claims data to be able to understand the economic burden, and even imaging. So can we be able to put all of this in a single place, and we then bring that so it's accessible to patients. And we ask them along the way, would you like us to share this with researchers? And if the answer is no, that's fine. But if the answer is yes, which many of our patients, especially in the rare disease space, enthusiastically say, yes, I want to help drive this forward. In that case, we're then able to share it with partners, biopharma companies, academic researchers, patient advocacy groups, with healthcare providers as well. And by doing so, we hope that we're able to push forward research. And bringing together all this information isn't new. We've known for many years, sometimes decades plus, that having all this information in a single place can really be foundational, but also transformational for understanding disease and pushing forward research. But the approach we're taking is new. So for many years, there have been these traditional in-person natural history studies, which have been very helpful with better understanding disease, and they played a critical role. And there have been some challenges with those as well. First, these can take years to develop the data needed to really understand a disease. They can be expensive, so just raising the funding for them can be a challenge. Sometimes it's millions of dollars to do that. There can also be some issues where it collects the information while that patient is treated at those sites, but doesn't necessarily get the years and years prior to going into those studies. It may also not capture from all the clinicians that those patients are seeing, because we know clearly that there can be more than one site, more than one care team that's helping to guide that patient's care. And then finally, we know, depending on how far you are away from that site and what your own family situation is, it can be challenging, right? It's not easy to jump on a plane, fly across the country on a regular basis. So there is some selection bias across those families who are able and willing to do that, and then those who might not be able to. And then finally, there can be challenges with actually getting that information back. In certain cases, families contribute, but they might not actually be able to get that information themselves and use it to guide their own care. So our approach aims to build on this and do it in a new way that helps to address some of these drawbacks. So I'll start to talk about our Ciitizen platform, which works by allowing patients to come onto our site, and they request their medical records from all the institutions they've seen using the HIPAA right of access. So there is a law that's passed that says that patients have a right to access the entirety of their medical record. Just because there's a law doesn't mean it's easy, but it is there, and that's essentially where we start. So we use that HIPAA right of access to request your medical records on your behalf across all the institutions that you've seen, going back up to 10 years. We then collect all these records, and this can be hundreds, sometimes thousands of different pages of medical records, again, including all the unstructured notes, the EEGs, prescriptions, genetic and other lab reports there. And we take these, we scan them, so electronically they're uploaded, and we make it available to individual patients. So it's added into your account so that you can have these in a single place and be able to do what you choose with them. So for example, if you're going to get a second opinion, you can really quickly add the email address of your clinician and be able to share it. So you don't have to wait out 6 or 8 weeks for that next physician offices to be able to track down all the rest of the records. So once we now have those medical records, we then make sense of them. So we have machine learning platform, which then pulls out the really meaningful endpoints from all those unstructured notes. And so we're using technology to be able to identify what are those pieces, but then we also have human review. So we have 2 separate sets of humans who are trained in these clinical areas to be able to review it, make sure that what we're pulling out through the machine learning is accurate. And as we do that, we find that both get better, right? So as the humans correct the machines, now the machines know, hey, here's what we need to pick up. But we also find that we get more and more refined so that the humans are picking up new things and not the same things over and over again. And then finally, as we have all this information, if our patients tell us that they'd like to share this de-identified information with researchers, we're able to do so on their behalf. So let's take one more step deeper on how this actually works in practice. So we have shown here an example of an actual medical record where you have the physician's unstructured notes following a clinical visit. And you can see here that we have those blue boxes around specific unstructured notes. And then with the dotted boxes, you'll see a structured term. And we use things like SNOMED, which are this database of very structured hierarchical medical terms. And then there's things like RxNorm, which is a standardized database for prescriptions, and then LOINC, which is used for lab codes and others. But I'll dive into one there, which you can see under the motor paragraph. So the second paragraph, you can see decreased tone throughout. So here's an example where physicians might have many different ways to talk about the same thing. And the standardized term is generalized hypotonia. However, you can see here that the way that the clinician described it was decreased tone throughout. So we go through and we pick all of the different ways that clinicians might describe hypotonia, and we're able to categorize them, tag them, and then all point them back to the same standardized term, which is generalized hypotonia. So then if we're able to go through and look at 30, 40 different patients, we'll be able to tag that generalized hypotonia with a date, even if the physicians have described that same term in maybe dozens of different ways as they're typing out their notes. So what this allows us to do is not only be very targeted, pull out all that really rich information from those unstructured notes, but do it in a standardized way, so that as we're producing the structured data, the researchers don't have to go through and sort it and do their own interpretations, right? We're trying to put it in a way that makes it easier for them to understand in consistent terms what that patient journey has been across many different patients. And we're starting to see that this isn't just a data collection exercise. We started to see that this is actually helping some of our partners move faster to get new therapies and new clinical trials available to their patient communities. And I want to walk you through just one of those with a company called Praxis Precision Medicines. They're a company based in Boston that focuses on rare neurological disorders. We first met with them about 2 years ago, and they were focused on a disorder called SCN2A, so a genetically defined rare neurological disorder, which commonly shows up with intellectual disability, as well as seizures. And at that point, there hadn't been any natural history well documented about SCN2A. And so from the perspective of the FDA and other things, one of their things they require is a good understanding of what does the natural history, what does the burden of disease look like. And so one of the first things Praxis needed to do was have a way to collect this information. And one of the options would be to go through one of these more traditional in-person natural history studies. And as we talked to them, one of the scientists there actually was a parent of a child with SCN2A. And so as we described our approach, and we said, look, like we think we can get you this information in under a year, and so we think we can help you move faster with the FDA and actually get your IND filed and be able to start clinical trials. And so this mother researcher, she said, great, well, how about you start with my child? I'll give you the right to go and collect our medical records, and let's see how you do. And as we did that, we said, great, let's get started. And within a couple of weeks, we came back, and we were able to share with her, hey, here are all the medical records that we collected. And by that time, I think her son was a few years old, so there'd been multiple years. Her journey had begun years before that. And she said, this is fantastic, right? There are even things in here that I've forgotten, right? There are diagnoses, there are clinicians that we'd visited that I even forgot, and even the time frames of some of them, right? If you'd asked her, say, hey, what was their first diagnosis of a seizure or other things, right? Like I think for some of them, she knew exactly, right? With others, she was, after a few years, she was a little bit like, oh yeah, maybe I was a couple months off. And so with that blessing, we decided to move forward with them. And so we started recruiting a cohort of SCN2A patients. We were able to collect medical records on their behalf. And we're ultimately able to share many of those records with Praxis's team, who then were able to do things like, number one, be able to submit this information to the FDA as a part of their IND filing, to be able to say, here's the burden of disease and here's what the natural history looks like. And so that alone was a big step forward, because with that IND filing, they've now started their path towards having these clinical trials available. But that's not where it ends, and that's not the utility of this information alone. So Praxis had a bunch of questions about, well, what should our clinical endpoints be? And in particular, they're focused on just gain-of-function variants. So their questions were, well, how does seizure frequency, and maybe when seizures stop and when they begin, how does it change if you have a gain-of-function variant versus if you have a loss-of-function variant? And that data wasn't available at that point. There wasn't a paper they could look at. There wasn't a database they could go into. And if they didn't understand that, especially for gain-of-function patients, they might set up their trial in an ineffective way. So even if their drug was being effective, right, their trial still might fail, right, which would be a huge setback not only for them, but for the SCN2A community. So with this information that we collected, they were able to have a really clear idea of when does seizure stop, right, at what time point, and in particular, and how does it look different for gain-of-function patients versus those with loss of function or other variants. So ultimately, this has been a critical tool that's enabled them to move faster. So within 2 years, they were able to file that NDA. From the time we met with them, within 2 years, file that NDA, get it accepted by the FDA, and now be on a successful path to really offer the first clinical trials for SCN2A. But also have confidence that they're designing their trials and setting themselves and their community up for success. And I'll mention, I've shared a lot here. This is all public information. We did a webinar with Kelly, who is the mother and the researcher from Praxis, who has an SCN2A child. So if you'd like to dig deeper and hear more of this, she's clearly more articulate about this journey and her own personal journey than I am. So I'd suggest looking it up. If you look up Praxis and Vitae webinar, you can find that there. Okay, so that's a little bit of who Invitae is, what we're trying to do, as well as what we've done with Praxis. But let's talk about your data. Let's talk about KCNQ2, and let's talk about the work that we've done with the Alliance, and what we're seeing so far, and how you can take part in this. So we currently have 44 patients with KCNQ2 who are citizens. It's roughly split between male and female, and the age ranges from everything from 11 months up to 30 years, with a median age of around 7 years. So within this cohort of 44 patients, we've seen 34 unique disease-causing variants within the KCNQ2 gene. So pretty diverse. Among those 34, there are 6 variants which we've seen more than once. And you'll note here, I know we had some presentations on missense and nonsense and other variants. The majority of what we've seen within this cohort are missense variants. And there's one variant in particular that we've seen that's the most common. So this variant you'll see there on the bottom represents the variant that we've seen for around 9% of the cohort within Ciitizen. All right, let's talk about some of the diagnoses. Each patient that's currently within Ciitizen, we've seen an average of 32 diagnoses per patient. Now, and if we look across all patients, there are 222 unique diagnoses just in the first year of life alone, right? So that's looking at every single one of the patients that's currently in Ciitizen. There are 222 different diagnoses that we've seen across all of them just within those first 12 months of life alone, which really shows the heterogeneity of how this presents and all of the different comorbidities which are associated with KCNQ2. One of the areas that really stands out from this are GI-specific diagnoses. 89% of the cohort that we've seen had at least one GI diagnosis. But GI issues are clearly not the only thing we're seeing. We've pulled together a word cloud here to start to give you a really quick visual sense of what are we seeing? Like, what are the diagnoses that are coming through these medical records? And where the word shows up larger, it means that we see it more often. Smaller means that it's relatively seen less. And so some of the things that are coming through most are likely not surprises to this community: developmental delay, epilepsy, dependence on supplemental oxygen, vomiting, dependence on feeding tube. But there are many others that are relatively less common, but we're also seeing within here. I will note too, seizure-free, right? Seizure-free is one of the biggest ones we've seen, right? And that doesn't mean seizure-free forever or for moving forward. It means that there's a period where these patients have been without seizures. But given the prominence of the GI diagnoses that we're seeing, we wanted to take a closer look and look at what are these GI diagnoses and when are they happening. So if we look at just the first year of life, we've broken them out by month and trying to characterize the number of patients of that 44 patient cohort based on when they got the diagnosis for a GI symptom. And what you find here is, nearly all of them had some kind of a diagnosis, or many of them had in that first month of life. So it's very common within that first month to have some kind of a GI issue. And you can see some of the most common are things like dependence on feeding tubes, constipation, feeding difficulty, GERD, jaundice, as well as vomiting. But there are additional diagnoses that happen throughout the rest of the first year of life. But these GI issues, while they may start in the first year of life, they continue throughout the patient's journey. And we find that if we look at throughout the patient's journey, again, not just through that first year of life, but to where they are today, we find that the majority, 61%, have some form of constipation. Around half have feeding tube dependencies and feeding difficulties. GERD is almost 50% of patients. Vomiting is around a quarter, and then neonatal jaundice is right at 16%. So these are just the top 6 GI-related diagnoses that we've seen in the data. But hopefully that resonates, but also might be helpful in getting a sense for what are we seeing across everyone who's so far participated in Ciitizen. Great. So I think what we've heard is that this information provides an incredible amount of depth, not only on the genetics, but also on the patient journey, the phenotype, the diagnoses, and being able to pull apart some of those relationships, right? Not only the heterogeneity that we heard about earlier today in a number of our presentations, but what are the links, right? Like, what are the links between the genetics and different things? And what I would say is, as you all think and you consider, is this something that you want to take part in? There is tremendous value in sharing your own patient story, right? Like every patient here has a unique story, and being able to include that and share it with researchers will help them understand the disease better and be able to push forward and develop therapies that hopefully can one day come to market, but also be able to design those trials for success, right? The more they're able to understand about KCNQ2, the better setup they'll be for pushing forward. So this is one way where you can participate in research, drive it forward with relatively minimal effort. So signing up should take less than 15 minutes. You should be able to do it on your laptop. And we'll talk I'll give you some more information about that, but this is in a relatively light way you can help drive forward research. Secondly, you can get access to your medical records. So as I mentioned, as we collect all these hundreds and sometimes thousands of pages of medical records, we upload it to your portal. You can have them with you, and you can do things like share it with your clinicians or with researchers or others, right? It's yours. It's there for you to guide who you want to access it. And I will mention that one important thing is, medical records, the institutions you've seen, are not required to keep those medical records forever. Typically, it's around 10 years that institutions don't have to hold on to medical records. So as your children get older, those medical records could be expunged and they could be gone forever, right? And that might at some point be important for you to be able to have access to those, but they also might be important for research. So being able to collect them yourself, house them and store them could help not only your community, but also your family as well. And then finally, I will share, all of this is free, so we don't charge patients ever for this. And that's regardless of whether you decide to share your de-identified information with researchers and pharma companies or not. And so finally, I do want to share just these, which is if you're thinking about it or you want to chat with somebody or you're ready and you're just like, yes, I'd love to sign up, here are two links that you can do so. These link to our website, so they allow you to join the study, or if you're like, hey, I'd just like some support from somebody to help me with onboarding, you can schedule a time to do so here. There's also, if you follow the link on the left, there's a bunch of links for questions, so if you want to get in contact with someone to talk more about it. And I will just say, I want to thank the Alliance and all of you for inviting me here. Coming here are really the most impactful days that I have, right? Like I love hearing how the work that we're doing is important, but I also love hearing what are the gaps, right? So on the one hand, I love to hear that we're making progress, but also, hey, what are the things that we need to work harder on? And really the only way that I feel like I can get that is to come here, hear from you all, and hear from the researchers and others who are working hard to make progress. So I want to thank you. Also want to thank Biohaven as well as Xenon for their support in making this happen, as well as the Alliance. So I will pause there, and I'd love to open it up for any questions.
One thing I wanted to ask you right off the bat is we have a large international population. So, and I know that some of the countries are English speaking and some are not. Can you give a little breakdown on who might be able to participate now and potentially in the future?
Absolutely. So we know this is a global community. And so being able to have representation outside of the US is important. Right now, the way that we collect medical records through the US is, again, through that HIPAA right of access, which is a US law, so it doesn't apply outside the States. So currently, if you are outside the States and you have your medical records, you are welcomed to create an account, upload your medical records, and if they're English speaking, we're able to use those. We are working on being able to expand our offering to additional languages outside of English, but for those who are in English-speaking countries outside the US, if you can collect those medical records, we welcome you to upload them and submit them as well.
There's a question in the back. Wait till we get that mic.
We're in the UK and Lauren is 32 years old. Most of her medical records are in paper form, that we've got files like this big. For uploading them, how would that be, like each individual document and sheet going up, or is there another way of doing it?
I would hope there's another way, because my guess is that would take a team of people maybe weeks to do. What I'd suggest, if you're able to get in touch with our team, so on one of those links, they're probably the best ones. I'm sure they've had this question many times before, and they would probably be the best one to say, here's how we think we could tackle it. Yep.
Yep. Hi, thanks so much. I'll have to give full disclosure. We've accessed the Ciitizen data for the SYNGAP1 project, which has just been phenomenal. And I was not a believer in the AI technology. I'm a clinician scientist, and I didn't think we'd be able to find comparable data. So I just want to put that out there that I'm a bit of a convert. My question is one that Jim and I and others had talked about in the past, which is that you'll hear through the day we've got a lot of the families here and others who've enrolled in other studies, and we would really like to harmonize. And so is there a GUID or is there some sort of identifier so that somebody could say, when you access a Ciitizen database, which Brandon here is like, hey, can we access this? Like, yeah, well, when we access this, how do we know which child is which if the parents are able to give us permission? There's got to be a way to do that.
Yeah, absolutely. Because I know, there are various studies going on, and one would be how do we harness this to bring them together rather than have 44 here and 20 there and 15 there, can we bring it together to have a larger group? So I think that's one question, but also potentially two, I know the question sometimes comes up, are these the same patients, right? Which would also be helpful to know. Let me take that question back, right? Because I think that's one that I haven't heard that we have a way to do it, but I'm sure there's got to be a technical way. I know that there's starting to be more and more approaches for us to overlap and find ways to identify and make sure we know who's who. And then there's probably IRBs and other questions about how do we put those together in a meaningful single place. Yeah.
I've got one from online, or a couple from online. Are there certain criteria that need to be met before a pharmaceutical company or research group make a commitment to develop genetic treatment for children based off your platform's data? And then I'll just ask all of them. Who advocates and forms those relationships? You have our kids' data. Who's the voice connecting with the pharma world with this data?
Okay, I'll start with the first one, and then I might need to ask for a clarification on the second one. So the first one, what's needed for pharma companies to start working on these? What we found is that sometimes the lack of data and lack of understanding of what's the natural history and how many patients are diagnosed, that in and of itself is a barrier, right? Because that creates uncertainty, where many biopharma companies, if they start from identifying targets and then they move into, well, which ones should we move into the clinic? If they're not able to answer questions like what's the natural history and how many patients are diagnosed, that makes it a whole lot riskier. So, one of the ways that we found that we can drive forward research is by collecting these really robust natural history data sets, which help answer those questions. And, there have been other examples. I know, SYNGAP was one of the examples that was mentioned here. That was one of the earliest groups we worked with, and they've got a couple hundred patients on their platform, and it's really been transformational in terms of the number of companies who are now investing in those because they've had clarity and they've said, great, we understand what it looks like and we know about the patient population, and this will enable our researchers to have more clarity about even how to design the trials or how to recruit. And then can you repeat the second question?
Yeah, I think the second question is really like whose role it is, to then, so if you've got 200 patients or like however many we can get for KCNQ2, like whose role is it to go and pitch pharmaceutical companies almost?
Yeah, good question. Invitae plays a part in it, right? So when we start to collect this information, we go out and talk to pharma companies and we let them know that we have some of this natural history data, which could help them. I'm sure others do, right? Scotty and others, the Alliance does too, right? They go and they talk and they say, hey, great. And that's a part of it too, right? Having an organized community where you're able to say, and you can have those conversations is a part of it. Academic researchers, right? Like they play a big role in being able to help push forward and do a lot of that foundational research. And, patients as well, right? I think starting to have more and more of awareness of what these disorders are, I think gradually starts to get to the point where, again, researchers, it's not the first time they've heard about it, but they can also have confidence they know how to move forward.
Yeah, let me just jump in there. This is a really very important program. That is a great problem to have, if you know what I mean. In other words, getting more pharmaceutical companies interested, getting more academic institutions interested. It's a numbers game. So I sometimes hear from people who say, well, I don't know what we can do. I'm really busy. We're completely stretched. We have too much going on. This is one thing you can do. If you can do this for your family, if it feels right for your family, there's so many reasons to do it because it's an aggregate, right? The more numbers that we have, think about it from the perspective of, oh, come on up. You can come. Yeah, bring her up, Cammie. She's upstaging us, and she's so much cuter. But think about it. If you have 5,000 people in a database, you're going to be more interested than if you have 5. You simply are, because you can start to see patterns, and you see that there's an engaged community to work with. And when we started out, there were just a few of these rare genetic epilepsies. Now there are hundreds. So if we want to get people to be interested in KCNQ2 DEE and get this kind of action, working with people like Invitae, and well, now Invitae Citizen is one thing, that's really important. So I'm just mentioning it because it's something that we can all do. Thank you so much, Daniel. Really appreciate it.